Welcome again to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. As always, we will continue to bring you the latest real-world information and insights on healthcare, life sciences, and wellness in the Middle East region. This week's review will discuss a variety of countries in the Middle East and the relevant developments, public health developments, healthcare system updates, disease surveillance, preventative health initiatives, public health policy changes, and the impact of regional situations on health system functionality. Everything you hear will consist of trends, insights, and the latest developments across the Middle East region for the week leading up to the 24th of April 2025. As always, our information is drawn from regional health ministries, institutions, advanced data, and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. United Arab Emirates, UAE. The UAE's health sector saw a significant development this week with the Ministry of Health and Prevention, MOHAP, approving Biomerica's Fortel ulcer test for detecting H. pylori infections. This approval reflects the UAE's continued commitment to advanced diagnostic technologies. In parallel, a new market report on the UAE's e-health sector, published by OpenPR, highlights the sector's growth and competitive landscape, indicating increased investment and expansion of digital health services. Saudi Arabia. Saudi Arabia's focus this week was on maternal and child health. A cross-sectional study published in Curious explored the prevalence and risk factors of postpartum depression and its impact on neonatal health in Riyadh. This research underscores the importance of mental health support for mothers. Concurrently, ResearchGate published a study focusing on adolescents' perceptions and behaviors towards periodic health examinations in Riyadh, providing valuable insights into youth health engagement. The WHO Regional Director also visited Riyadh this week, emphasizing the importance of the strategic partnership between the WHO and Saudi Arabia, particularly in addressing the humanitarian health needs of the region. Egypt. Egypt's health system faced challenges related to the ongoing situation in Gaza. Aram Online reported on Egypt's commitment to treating Palestinians injured during the recent conflict, putting a strain on Egyptian healthcare facilities. Syria. Syria's health sector continued to receive international support. Syrian Arab news agency, Sana, reported on discussions between Syrian and Norwegian officials to strengthen the Syrian health system, focusing on infrastructure and capacity building. Palestine. The health situation in Gaza remained critical. UN News and Mirage News reported on the dire conditions in displaced communities, with sewage, trash, and disease posing major threats. The Killeen Daily Herald highlighted the difficulties faced by dialysis patients accessing treatment due to the ongoing blockade. Yemen. UNICEF reported on efforts to reach children in Yemen with essential health and nutrition support, highlighting the ongoing humanitarian crisis and the challenges in providing basic healthcare services. Regional summary. This week in the Middle East region witnessed a continued focus on addressing the health needs of vulnerable populations, particularly in conflict-affected areas like Gaza and Yemen. The situation in Gaza continues to be critical, with severe shortages of medical supplies and sanitation challenges exacerbating health risks. International support for Syria's healthcare system highlights the ongoing need for external assistance in rebuilding health infrastructure and capacity. Elsewhere in the region, countries like the UAE and Saudi Arabia continue to invest in improving medical capabilities and preventative health initiatives. The WHO's engagement with regional partners emphasizes the collaborative efforts required to address the region's complex health challenges. Overall, the week's developments underscore the interconnectedness of health systems within the Middle East region and the importance of ongoing cooperation to strengthen regional health security. Emerging health priorities include maternal and child health, addressing the health needs of displaced populations, and strengthening health systems' resilience. The need for sustainable funding and investment in healthcare infrastructure and capacity building remains paramount. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you. Have a wonderful day and see you next week.